Good afternoon, everyone. My name is Tarnika Manning, and I'm the Community Outreach Manager for the Metropolitan Chicago Breast Cancer Task Force. We're a nonprofit organization working to reduce disparities in breast cancer mortality rates here in Chicago. To learn more about the task force, reach out to us at our offices at 312-942-3368, or you can reach us on the web at chicagobreastcancer.org. We're on social media at Facebook and on Twitter. You can reach us at our handles at MCBCTF. You are watching a live call-in television program brought to you on cable channel KNTV 21, and we're online at knTV.org/hotline. During our show, we discuss various breast cancer issues that affect women of color here in Chicago. I invite you to call in if you have any questions. The call-in number is 312-738-1060. Our phone lines are open. Today, our guest is Dr. Mary Ellen Pavone. Dr. Pavone is an assistant professor in obstructions and gynecology, and she's a reproductive endocrinologist?
Yes.
At Northwestern. She's also part of the Northwestern's Fertility Preservation Program, which we're going to talk a lot about today. If you have any questions, give us a call. We're at 312-738-1060. All right, so welcome. How are you?
Thank you for having me.
I know Dr. Pavone, she took this assignment very last minute, so we're very happy to have her here today. So we're eager to hear what she has to say. So can you tell us about your background?
Sure. So I am a reproductive endocrinologist and infertility doctor at Northwestern. So I did my residency training in obstetrics and gynecology, and then a 3-year fellowship in reproductive endocrinology and infertility, where we basically learn how to take care of fertility issues as well as fertility preservation issues.
Okay, great. So what is fertility preservation?
So cancer and cancer treatments and other medical conditions can make it difficult or impossible for patients to have children in the future. And so fertility preservation is a field where we try to save patients' fertility so they have family building options in the future.
Oh, okay. So tell us a little bit more about the fertility preservation program at Northwestern.
Sure. So at Northwestern, we actually are affiliated with Lurie Children's Hospital as well, and we offer fertility preservation options for men, women, and children undergoing cancer treatments.
Okay. All right. So what is your role with the fertility preservation program?
So I'm one of the physicians who sees women or adolescent girls who have cancer and are trying to preserve their fertility prior to undergoing therapy.
Okay. All right. So again, if you have any questions, give us a call. We are live, 312-738-1060. How long have you been a part of this program?
So I've been a part of Northwestern since 2010 when I began faculty there. I actually did my fellowship at Northwestern as well, so I've been at Northwestern since 2007. And pretty much since the beginning of the fertility preservation program there.
Okay. So the program's been in existence since?
Since 2005 is when we started to do fertility preservation for women with cancer, and then it really took off starting in 2007 when we received a large NIH grant to study fertility preservation.
Okay. All right. So what makes your program unique to other fertility preservation programs?
That's a great question. So one of the great things about Northwestern is that we see men, women, and with our affiliation with Lurie Children's, also children. So we can offer fertility preservation options to all patients. In addition, we have a fertility preservation patient navigator, and this individual is unique in that she can really guide the patients throughout their therapy and make sure that everything is in place from the different doctors' perspectives. We also have 2 dedicated psychologists to take care of patients' emotional needs, and we also take care of patients after their cancer as well. So any kind of survivor issues, we also help take care of patients in that respect as well.
Okay. So funny enough, our original guest was going to be Kristen Smith,
Yes.
who is actually the patient navigator for the fertility preservation program. But she's stuck in New York, so hi, Kristen. So, we'll talk to you. Like you said, you mentioned that the navigator position is very unique to your
Yes.
program. So does Kristen go through the whole process with the patient from start to finish and through survivorship? And
Yes. So Kristen is a great resource. She has a phone line where she takes patients' phone calls, and then depending on what their needs are, she appropriately refers them to the right person. And then she also helps communicate what's going on with the different specialties so that the oncologist knows what we're doing and we know what the plan is in the future.
Great, great, great. All right, so you mentioned that there's a number of health professionals that are involved in fertility preservation.
Yes.
So, again, what are the health professionals that make up your whole team?
So there's reproductive endocrinology, there's urology for men with cancers, and then there's oncologists, gynecologic oncologists, or medical oncologists, depending on the types of cancers. And then we also work with children's pediatricians and pediatric oncologists, as well as pediatric surgeons.
Okay. So there's different departments within Northwestern that you work with.
Yes.
So it's not just
Yes.
one.
And then we also have 2 psychologists and the patient navigator.
Awesome, awesome. So are there any other departments outside of the medical profession that you work with, or is it just...
It's pretty much all within the medical professions.
All right. So you mentioned that you got a huge NIH grant. So what type of research is being done at your clinic?
So we do both basic science and clinical research at Northwestern. So in terms of our basic science, one of our large projects is we're trying to learn how to grow baby eggs outside of the human body. And that's with Dr. Teresa Woodruff, who's a very innovative scientist at Northwestern. And on the clinical side, we're trying to see how decisions get made. So why do some women choose to preserve their fertility? Why do some women choose not to? We're trying to figure out factors involved, and we're also trying to figure out how they fare during the process. Are their ovaries stimulating like they would if they were infertile, or are they stimulating better or worse, and why?
So are you doing, I know you mainly work with women. Is there any research done around men and fertility?
Yeah, so for prepubescent boys, actually, there's a new protocol at Northwestern where we're learning how to freeze the testicular tissue to perhaps be able to extract sperm in the future. So that's kind of up and coming for men. There's also studies being done in men who's choosing to freeze their sperm, who's not choosing, and factors involved in that decision making as well.
Great, great. So there's a lot of innovative stuff that's going on at Northwestern.
Yes.
If any questions, give us a call. We are live, 312-738-1060. Give Dr. Pavone a question if you have any for her. All right. All right. So what type of cancer patients do you usually serve through the fertility preservation program?
So on the women's side, our biggest group is breast cancer. And we also see a fair number of women with lymphomas and leukemias. The last large group are gynecologic cancers.
Okay. All right. And then for the man, I'm assuming that it's like cold.
A lot of
Prostate.
leukemias,
Okay.
lymphomas.
Okay.
Yeah.
And with the youth, is it
A lot of leukemias, lymphomas, and sarcomas in young patients.
all right? Great. So what's the process for developing a plan for our patients?
So we have to, well, first of all, it all depends on what the patient's long-term goal is. Do they want children? Some people have already had their children and they're not really interested in that, but want to try to minimize some of the other side effects from their chemotherapy. But in patients who would like more children, we have to look at how old they are, if they have any infertility issues to begin with, and the type of cancer treatment that they're getting. Is their cancer treatment likely to make them infertile, or is it not likely to make them infertile? And then we take all those factors into consideration and come up with a plan.
That's interesting. So are there certain treatments that do not interfere with fertility that
Yes.
Okay.
So there's certain chemotherapies that are considered not very toxic to the ovaries. So those patients are counseled a little bit differently than women who we know are getting pretty strong chemotherapy that may very well affect their fertility.
So how does age affect your fertility as far as for preservation?
Yeah, especially for women. So women are born with the maximum number of eggs that they're ever going to have in their life, and over time that number declines. And with chemotherapy, that number declines even quicker. So the chemotherapy can affect women's ovaries and make their reproductive lifespan much shorter.
Oh, okay. All right. So what are some options that they can be offered to your patients?
So in menstruating women, we can offer egg freezing or embryo freezing if they have a partner. So this is a process where women would basically undergo an in vitro fertilization cycle. So daily shots of low levels of hormone medications to make their ovaries produce lots and lots of eggs. And then we retrieve the eggs surgically and then either fertilize them if they have a partner or freeze them unfertilized.
Okay.
In patients who are not menstruating yet or prepubertal, there are some investigational protocols that involve removing an ovary and freezing them if the patient's parents actually consent to it.
Okay. All right. So what about the men? How's the process for that? I know you say you don't really work with men, but
no, but I know.
Yeah.
So for men, it's sperm banking as long as they're pubertal.
Okay.
And as I mentioned before, there's an investigational protocol about using testicular freezing.
Okay, great. So again, if you have any questions, we are here live at 312-738-1060. Give us a call. Okay. All right. So does the fertility preservation interfere with the cancer treatment?
So no, fertility preservation actually doesn't really interfere with the cancer treatment. We can do if the patient is choosing to freeze eggs or embryos, we can actually do a cycle in about 2 weeks of time. And generally that imposes no problem to chemotherapy scheduling. For a lot of times with breast cancer patients, we actually do their fertility preservation after their surgery and before their chemotherapy.
Okay.
So during that kind of window of time.
Okay. All right. So how long is the typical process for
freezing eggs or embryos? It's about 2 weeks.
Okay.
During that period of time, you would come in to see the fertility specialist about 5 to 8 times for blood work and ultrasounds.
And that's both for embryo freezing and
egg freezing.
Okay,
Yep.
Great. All right, so are your services only available for Northwestern patients?
No. So we actually have plenty of patients that are not seen at Northwestern for their cancer therapy that come to us just for fertility preservation.
Cool, excellent. So what are some commonly asked questions that you get from patients?
So patients are often wondering about how long a process would take. Patients are also wondering about the cost of the process and whether or not it's covered by insurance.
Okay.
And so Illinois is a fertility-friendly state, and if patients have insurance that covers fertility treatment, then the fertility preservation may get covered. Otherwise, it can be costly. It's about $5,000 plus the cost of medications, which can run another $2,000 to $7,000. But a lot of times the medications we're able to get them for free through various grants that we have.
Excellent. So those are generally questions that people ask you when they come in.
Yeah, they also ask about the side effects of the medications and if they hurt.
Yeah, I was gonna say I was gonna ask about pain.
Exactly.
So, my first.
Right. When patients hear shots, they get a little worried. But the shots are very small, and even patients who really don't like needles are generally fine with these medications.
All right. So with the medication for increasing the egg production, I mean, I would be concerned about being extra hormonal. Do they affect your hormonal level, or?
So not really.
Okay.
Not as bad as some of the other medications that we use in the fertility world. The medications that we use are the same hormones that are produced by your brain. We're just giving to patients in higher numbers or higher amounts, and so the side effects tend to be minimal. Most patients experience some bloating. As the medications are working and your ovaries are growing, you'll feel that, but not as much moodiness.
Okay. So no hot swings, hot sweats.
No.
All right. So how many patients do you usually assist?
So our numbers are growing. And last year we did a little bit less than 100 patients. So
Of all
quite
ages,
a few.
right?
Yeah.
All right. So what is your rate of success as far as conception after fertility preservation?
So that's a great question. And a lot of that depends on the age of the patient and how many eggs or embryos we were able to harvest. We think that the younger the patient, the more likely they are to conceive. And so for patients less than 35, it's probably about a 50-50 chance. And numbers go down after the age of 35.
So even if you freeze at a young age and conceive,
There's no guarantee.
Nice.
I know.
Okay. All right. So again, we are live. If you have any questions for Dr. Pavone, give us a call, 312-738-1060. All right. So are there support groups for patients that are considering going through the fertility preservation process?
We don't have support groups for fertility preservation per se, but a lot of the support groups that deal with young and adolescent age cancer patients do also provide some support. Things like Stupid Cancer or Immerman Angels.
Oh, yeah. We work with
Yeah.
Johnny. Oh, great. So I did have a couple questions for Kristen regarding like her hotline. I don't know
Yes.
if you are aware of like how many calls that come in and
I know she gets a lot more calls than the patients she refers to us, but I'm not exactly sure how many.
okay. And do you know kind of the questions that she's posed when she's on the hotline or?
I think that a lot of the questions are if they would qualify, if the patients would qualify to freezing eggs, freezing embryos, or freezing sperm, depending. So again, kind of how old the patient is and what kind of cancer they have and what their treatment plan is will all guide decision making.
Okay. Do you happen to have her hotline number with you?
Yes. 312-503-3378.
All right. Can you say it one more time?
312-503-3378.
Great. So I hope you got it. Kristen's not here, so she might be answering the hotline right now. So if you have any questions, give her a call, and she will definitely answer your questions. I know she said that she gets a lot of patients from even like all the hospitals around here, the larger hospitals, University of Chicago,
Yes.
Rush, and they
Yes.
call and they ask a lot of like just general questions just to learn more about fertility
Right.
preservations because they Googled it and her name pops up. So
Yes.
so definitely give her a call if you have any questions about fertility preservation after the show. But if you have some today, give us a call. We're here at 312-738-1060. All right, so again, we talked about the hotline, but how can someone learn more about fertility preservation?
We also have websites available, including myoncofertility.org. So myoncofertility.org. It's a website that was put together at Northwestern and kind of goes over treatment options as well as decision trees to help patients make decisions about what option is best for them.
So what is the process as far as like when you're given the options for fertility preservation?
So a lot of times it's based on patient's age and what kind of cancer therapy they're going to undergo, and how much time they have before they need to start treatment.
Okay.
So most patients can give us 2 weeks of time before they have to start treatments, but certain cancers, especially leukemias, really need to start treatment right away. So we don't really have time to do egg freezing or embryo banking for those groups of patients.
So are family members involved in the process?
A lot of times they are.
Okay.
If the patient has a partner, a lot of times the partner is involved. For our younger patients, a lot of times their parents are involved.
Okay, good.
And even for my older patients, sometimes their parents are involved as well.
No, I was saying,
Partners
like,
and parents.
Your mother, father knows best. So you
Exactly.
get
And
their
everybody's
advice.
welcome to the visits.
Okay. So it's when they are coming in, who all is involved in the initial planning process?
So generally, when they come in to see me, generally Kristen is also there. And then if they have a partner, the partner's there. Otherwise, a family member or sometimes a close friend is also there.
Okay, and so no other medical professionals are there at the initial.
Not at the initial visit.
Okay, right.
If they choose to do embryo or egg banking, then we also involve our therapist or psychologist.
Okay.
All of our patients also see our therapists who are going to undergo egg or embryo banking.
Okay, so who's the health professional that does the sperm banking?
That's one of our urologists,
Okay.
so Dr. Brannigan.
Okay, good. So we don't want to leave men out.
No.
This is a big issue for you as well, and there might be some women that just want to see how they can start planning ahead too, just in case they have some cancer issues in their mate's life at the time.
Yes, and Kristen Smith can help navigate those patient visits as well.
Okay, great. So how can someone reach Northwestern's Fertility Preservation Program?
So the best way is through Kristen at 312-503-3378. Otherwise, myoncofertility.org also gives some other websites that patients can use.
Okay, good. All right, so I know we talked a lot about the women. Just one more thing if you want to throw out as far as our youth that you want to share, or any of the other issues for men that we can go over briefly.
Sure. So we have several investigational protocols for prepubescent patients who who themselves or their parents are thinking of future childbearing, including ovarian tissue freezing or testicular freezing. Anybody who's pubescent, though, would be a candidate for egg freezing potentially. That could be a conversation that we have together. And for men, really sperm banking is the best option.
Okay, good. All right, so like I said, we are so happy that you were able to join us.
Yeah.
Is there anything else that you want to share with our audience about fertility preservation that they should know?
So the best time to talk about fertility preservation and initiate and consult is right at diagnosis. Because again, it does take some time, and really the best time is right away. So if you are or have recently been diagnosed with cancer, please ask your cancer doctor for a referral for fertility preservation. We can talk about your options, even if you choose not to. At least that will have been your decision, and all the options would have been laid forward for you. We hate when patients come back and tell us, I wish I had known about this earlier, I might have done something.
And again, like Dr. Pavone said, like they treat people who are not necessarily Northwestern patients.
Yes.
So definitely give them a call so you can go over your options. And definitely if you are going through cancer or just diagnosed with cancer, or you know someone, make sure you share this information with your doctor so you can have this conversation, so that, again, don't wait till last minute and you have all the options available for you, so you can make the best decision possible.
Yes.
All right.
I think a lot of patients get scared because they think it might be very expensive, but we have payment options available, and I hope that cost does not become a barrier to seeking this type of treatment.
And like you said, there's some grants available to pay for the medication, and your insurance company might cover it. So you definitely ask questions. So we always tell women that we work with at the task force that we want to empower them to be able to make the best choice possible.
Exactly.
So hopefully this information is empowering someone to make some really great choices. So.
Exactly.
Well, I want to thank you for being our guest today. This has been awesome. I learned a lot today. I hope you guys learned a lot as well. Again, my name is Tarnika Manning, with the Metropolitan Chicago Breast Cancer Task Force. If you would like to learn more information about what we do at the task force, give us a call. We're at 312-942-3368. And again, we're on the web at chicagobreastcancer.org. We are social media savvy, so hit us up on Facebook and Twitter, with our handles being MCBCTF. Again, I want to thank you for joining us this afternoon. Hopefully you have been informed about fertility preservation. We will be back next month, the third Tuesday at 5 p.m. Join us, and we hope to see you next month. Thank you.
Thank you.